what actually happens on day one inside a rehab center, because most of the family imagine the worst. What do you want to say about that?
Yeah, see, when a person of any kind of addiction comes to a rehab center, the first thing happens is the intake of the history. So there is a complete paperwork, then there is a comprehensive assessment of the situation, and the third thing is the medical evaluation, which involves the medical checkups, blood test, respiratory rate, heart rate, and everything, and also the drug screening, because you need to know what all drugs the person is taking, single drug, multiple drugs, and etc. There is also a comprehensive psychiatric evaluation, because a lot of these patients would be having a comorbid psychiatric condition. Also, it can be psychosis, bipolar, depression, anxiety. So there has to be a comprehensive assessment, psychiatric assessment, to modulate a personalized plan for the treatment of the patient. And also a lot of emphasis on the safety stabilization of the patient, and so that you give some time for the patient to settle in. Detoxification also in the initial period is very important. If there is a initial history, if there is a history of drug dependence and recent history of drug. Contrary to the normal belief, there is not much of apprehensions, because once the patient come in, you are introduced to the center. You have your chemical restrainment. Try to do things so that they get ease with the environment very easily. On majority of the situations, absolutely nothing to worry, and they gradually assimilate themselves into the treatment process.